Good morning, my dearest people. Mama Nurse Worldwide Health Tip is on. I'm giving you organic therapy for high blood pressure this morning. My last video taught you about how you can deal with yourself if you have high blood pressure. I like you lovely ones to please help me like, share and comment my videos. It's all on health tips. If you want to use organic therapy for high blood pressure, it is always good you consult your doctor or healthcare provider. Reason being that it will be a mistake and it may be a catastrophe when you say, I'm already on organic therapy and I'm stopping my medications. You don't just stop your medications like that. You have to be in line. You have to see your doctor or your medical person, the person that is taking care of you medically. You have to see them and let them know, I want to start using organic therapy. He or she will advise you if the organic therapy you are using, you want to use, will disturb you to continue with your health, with your medication, or if you may stop your medication or you may use it together. Now, when we say organic therapy, number one, you must always eat a healthy diet rich in whole grains, fruits, vegetables, and low-fat dairy products, and also low in saturated fats and cholesterol. This can lower your high blood pressure up to like 11 millimeter of mercury. You know, blood pressure is being measured in millimeter of mercury. With the organic therapy, with our medication, you must always watch your weight. You must always watch your weight. Those who their weight is much must be able to know how to watch their weight. Lose extra weight and watch your waistline. Your waistline. If you watch your waistline, you will know if you are losing weight or not. Your BP increases as your weight increases. Overweight causes disrupted breathing, the sleep apnea, which raises BP. Weight loss is one of the best ways to control BP. Weight loss is one of the best ways to control BP. Any amount you manage to lose lowers your blood pressure. E.g., for example, about 2.2 pounds of weight lost can make your blood pressure come down by 1 millimeter of mercury. The size of your waistline is important to trim because carrying excess waist around raises high blood pressure. It is very, very important. You must try to trim your weight. There are so many ways to do that. Any man that the waist measurement is up to or more than 40 inches, 102 centimeters is at risk. Waist measurement. And in a woman, when your waist measurement is 35 inches or 89 centimeters, if it is more than that, 35 inches or 89 centimeters, check the ideal ethnical style of your losing weight. There are some places that eating pounded yam every day, in the morning, in the afternoon, in the evening, does not increase their weight. And there are some people, if they do, it will increase their weight. Your healthcare professional will be able to guide you through in the system of losing weight. Oh, please try as much as you can to lose weight. You must be able to exercise regularly. Regular aerobic exercise can lower high blood pressure by about 5 to 8 millimeters of mercury. Continuation will help keep blood pressure from rising again. At least 30 minutes of physical moderate exercise every day. 30 minutes. This aerobic exercise are like jogging, cycling, swimming, and dancing. It reduces your weight and it helps you to be healthy. Set up exercise program like 2 days a week to help lower your blood pressure. Eat a healthy diet. Whole grains is good. Fruits is good. Vegetables is good. Low fat dairy products, low in saturated fat and cholesterol can lower high blood pressure by up to 11 millimeters of mercury. I've said that once, I'm repeating it because it's very, very important. Dietary approaches to stop hypertension, DASH, and Mediterranean diets. Dietary approach. Potassium lessens the effect of table salt, sodium. If you have the risk of high blood pressure, please lower your salt intake. Reduce your salt intake. Potassium, you can make your potassium to be high and lessen your sodium intake. Your healthcare provider will help you to track how much potassium needed. I will just give you some tips, but please see your healthcare provider. My people, Mama Nurse Worldwide Health Care Tip is speaking to you on how to use organic therapy to reduce your high blood pressure. Please share, like, comment on this video. Share the video, comment on the video, like the video. I will continue. Please reduce your salt intake. Your sodium is salt. Reduce it. There are some people, if they want to eat, when their wife cook for them, they will still put tablespoon of salt and add it to the food. You are killing yourself. Reduce your sodium per day up to 2,300 milligrams. Limit your sodium intake to 1,500 milligrams per day. This will definitely lower your blood pressure with some other therapy, either medication or organic. There are some people, when they want to eat junks, they won't even check either the label or the literature or whatever they write on it, where they write what the thing contains, so that they will know if it is in high sodium or not. Somebody that is having raised blood pressure should not, I emphasize, should not be taking high salt. By that, if you cannot get the amount of sodium in your processed food, you can just limit taking of sodium, processed food. High potassium intake is good. If you potassium intake, it's okay. But nothing should be too much. Your potassium intake should not be too much too. When you have high potassium, it is hyperkalemia. We have moderate amount of potassium we needed per day. That is 3,500 milligrams. You will get enough potassium in tomatoes, spinach, sweet potatoes, plantain, and some others. Potassium is an electrolyte, which is a mineral in the blood that can be measured by a blood test. You can get potassium through food. I've mentioned some: tomatoes, spinach, sweet potato, plantain, and many more. Potassium is better than sodium. You can get potassium through electrolytes, enhanced beverages, and excreted primarily through urine. You will excrete potassium primarily through urine, with a minority portion remained in the gastrointestinal tract. Potassium is good for our system. The blood potassium levels are as follows. Adults, that is an elderly person, 3.5 to 5.0 MEQL, or 3.5 to 5.0 mmOIL. Child, 3.4 to 4.7 is okay. And infants, 4.1 to 5.3 MEQL. Newborn, 3.9 to 5.9 MEQL. It's also okay as specified. We have specific amounts of potassium that is good for human body. Anything lower than the amount said, 3.5, 3.6 to 5.2 in an adult is low, and that person will be affected. Low potassium causes hypokalemia. So please increase your potassium intake by taking tomatoes, by taking potato, by taking plantain. And I said high potassium causes hyperkalemia. If you have hyperkalemia, it's not good. So you must be able to regulate. You must be able to regulate your potassium intake too. But potassium intake is better than sodium. Sodium intake affects anybody that is having blood pressure. But if you take moderately potassium in your potato daily, at least try to take potato, try to take plantain, if not daily, at least once or twice in a week. It will help your system. It will help your good health. There are conditions associated with high potassium intake, which I said is hyperkalemia. There are conditions also associated with low levels potassium. When your potassium is high, you may have a diabetic ketoacidosis. You may be dehydrated. You may have anorexia. You may have tissue injury. You may have Addison disease. But when your potassium intake is low, you may have hypokalemia, dehydration, vomiting, diarrhea, deficient. Definitely, when it is low, you have deficient potassium intake. Acetaminophen overdose, magnesium deficiency. Try as much as you can to always let potato be part of your diet. Potato intake. Let tomatoes intake be in your diet. Let plantain intake be in your diet. Other things that is organic is, and this organic intake that I want to tell you will, if you take it very well, it will lower your blood pressure. But I'm not saying that you should be taking them and stop your medication if you are on medication. This organic therapy is good to prevent hypertension and is good to cure hypertension. But if you are already on medication, please see your medical experts before you stop your medication. Always consult your healthcare provider before switching to herbal treatment, that is, stopping medication and switching to herbal treatment. Okay, the organic therapies, I mentioned garlic, ginger, hibiscus, onion, basil, black seed. Garlic has the compound called allicin in it, which lowers blood pressure. Ginger is also zingiber sativum. If you take it at least daily or alternate days, it lowers your blood pressure. Hibiscus is diuretic. It has diuretic effect. Hibiscus, that's the hibiscus flower. Sobo. It reduces both systolic and diastolic blood pressure. Especially if your hypertension is mild, it will cure it. But if it's not mild, take it along with your medication and always see your healthcare provider. Onion too is very good. Onion is rich in antioxidants that controls blood pressure. Basil is an antioxidant that relaxes blood pressure. There are places you can get tomato juice. It helps. So you have tomato juice, be taking it. It helps. It's a good organic therapy. Celery seeds, ewé pẹ́pẹ́sàn. Ewé pẹ́pẹ́sàn is very rich in iron, magnesium, and fiber. It's good as a therapy for your high blood pressure. Cardamom, Elaterica cardamomo, is packed with antioxidants. It lowers blood pressure and treats other symptoms of metabolic syndromes. It treats obesity. It levels your cholesterol, and it helps in insulin sensitivity. Parsley. This parsley, some school of thought says it's ẹ̀fọ́ Igbo. Some school of thought says it's one type of ewedu that the leaf used to be big like this. And some school of thought say most says it's ẹ̀fọ́ Igbo, and most says it's ewedu. So parsley, you can try to study about parsley. Parsley. It contains variety of compounds, e.g. vitamin C and dietary carotenoids that reduces blood pressure. It's very, very good. In a nutshell, the ẹ̀fọ́ Igbo is good. Ẹ̀fọ́ Igbo is very good. Ewedu too is very good. Even if parsley is either of it, even if parsley is efinrin, if it is efinrin, some school of thought says it's ẹ̀fọ́ Igbo, some school of thought says it's efinrin, some school of thought says it was ewedu, but the three are very, very good in the treatment of high blood pressure. The three are antioxidants, The tree have a high vitamin C. So the three, whichever it is very good. But you just take parsley. It's either ẹ̀fọ́ ìgbò, ewédú, or efinrin. Putting thyme in your food help you too. So my people, try to go through this video, digest it, share, like, and comment. Share, like, and comment. This parsley, in some school of thought, it says ewédú or efinrin, but the vitamins inside, vitamin A, vitamin E, vitamin C, vitamin K, vitamins found in parsley, and in addition it has pantothenic acid, potassium, copper, lithium, beta carotene, riboflavin, calcium, phosphorus, iron, folates. The parsley is very, very good. I advise you to go for efinrin. You know, efinrin also is diuretic. When you pluck efinrin, just rinse it, put it in your frying pan or your pot, put water, not too much, water that will infuse it and the color will come out. Boil it for 10 minutes. Start drinking. It works on your kidney. It flushes all the toxins in your system, and it helps. You will urinate very well, and it reduces your blood pressure. Good day, my people. I will round up the video now and coming again to give you more on your health, how your health, how you can be healthy. Mama Nurse Worldwide Health Tip. Please share, like, comment my video. Thank you. Bye.